I want to open up this session. We have a remarkable session here. I'm going to allow the gentlemen to each introduce themselves. They're all extremely important people in healthcare and in Health2O. They're all pioneers in their own ways. And we're genuinely fortunate to have them all. But by way of introducing them, I want to say that one of the things that makes them remarkable is that they have spent their careers working to use technology to the advantage of healthcare. They've spent their careers by working on standards and leveraging technologies to make care more available for patients. They've been right out there at the edge of everything that we're talking about for many, many years. Dr. Greene.
Thomas Jefferson said something very interesting, something radical and revolutionary, literally revolutionary. When the people are well informed, when they have the data, they can be trusted to govern themselves. When the people are well informed, they can be trusted to govern themselves. But that wasn't true for slaves. And it wasn't true for women. And it's still not true for patients. But that's about to change. I love that he used the word trust in there. That's probably the word that's been used the most in this conference that we've been together. Trust, 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 a little bit of satisfaction, simplicity. You can write down that trust and simplicity and satisfaction need to be two-way streets, or they're not going to work. It's not just we get them to trust us, we trust them. The people can be trusted. So I want to say just very quickly where I think we are today on October 23rd, 2008 in our journey, where I believe we will be, a radical prediction for 4 years down the road, and how we get there. Where we are. During my journey in medicine, we have switched from the focus of medical care being in the hospital to being outpatient. We try to take care of everything we can outpatient in clinics and offices, to the home, largely through the computers and the internet, take care of people even at home. And now we are just at the dawn of doing it wherever people happen to be, mobilely. We're at the beginning of mobile healthcare, which is another way of saying we're finally at the beginning of patient-centered medicine, doing it where they are. And that's where you are having fun. It's also where you are with real problems. This week, while we've been gathered together, my aunt, Alice, a joy-filled wheelchair woman, had a stroke and went to the emergency room. And because the doctor there didn't know her baseline, didn't have access to her records, and didn't know what was going on, even though it was a stroke that could have been stopped with TPA, just send her home. Normally she goes with my cousin who's a nurse, but they just send her home. And the next day she's back in the ICU, and it's not clear she's going to survive it. That could have been prevented by health information available at the moment. So where we are is at the beginning of mobile healthcare, really at the right place at the right time, patient-centered care, which means basically we're like at the Declaration of Independence. We are at the start. We have said it's time for patient-centered information, patient-centered healthcare. We have said it's time for Health 2.0. Some people are already living it, but the dominant paradigm is still the old government. It's still the old economy. It's still the old rule. So where are we going to get? I believe in 4 years, this ragtag group of people, by 2012, this ragtag group, the e-patients group, information therapy, a whole bunch of groups, big corporations, are going to actually overturn the current payment system, the current healthcare wasteful system in the United States. I really believe that's true. And for years, we've been working for that. And it feels like the healthcare system is this entrenched, barnacle-encrusted labyrinth, especially the payment part. And it feels like it can't change. But I want to tell you a secret. The healthcare payment system is a bubble. Just like the internet bubble. It looked like .coms were going to go up forever. The housing bubble. It looked like real estate was going to go up forever. The investment banking bubble that looked like it was going to go up forever. And these institutions that are 100 years old and marble lobbied buildings, a few weeks and it changed. healthcare system is a bubble that will change. I believe no matter who is elected president, no matter who our next president is, even if it's Sarah Palin, I believe that our healthcare system will change by 2012. It won't be the same as it is today. The economics will force it as more and more people get unemployed. We won't tolerate that waste you're talking about. So how we get, and there's already warning signs of it. The 210 million Americans, according in David's video, that don't have access to a doctor on the day that they need care. There's a lot of signs that the bubble is getting ready to burst. The powerful force that'll bring it about, we heard at our first talk from Clay Shirky, the power of the people coming together, very powerful. We heard from the Edelson, the survey numbers about how much people are looking for expertise. I believe it's when the power of the people and the expertise come together that the power happens. That's the transformational agent. And it's not just that they communicate now, but communicate with real trust and real openness, real mutual respect. We can really change things. It reminds me when I was a kid, going to a hardware store and buying epoxy glue. There was these two different compartments, and it's when they mixed that it was changed irrevocably. And for those environmental health enthusiasts, the hardener in there was BPA, the same thing you find in baby bottles and other things. Or as a pediatrician, finally, I'd say it's like puberty, that the body changes. It just takes a few drops of testosterone or estrogen to irrevocably change things. It's kind of slow. It takes several years, but it's irreversibly changed. And I believe that getting expertise into the Health 2.0 world, the wisdom of crowds world, data-based expertise, will produce this kind of irrevocable change.